State Health Department has confirmed to KHON2 that it is investigating a new case of Legionnaire's disease. That's a severe form of pneumonia.
The CDC says 1 out of every 10 people infected with the bacteria die from it. So how concerned should we be about this recent case?
Jen Bonisa tells you what you need to know. Jen.
Well, Dash, Marissa, I'm told that although Legionnaire's disease is rare, it's alarming because it can be fatal, and it's known to occur in clusters. The disease first got its name in 1976 when an outbreak of pneumonia struck a group of people attending the American Legion Convention in Philadelphia.
Legionnaire's disease is a potentially fatal type of pneumonia. Queens Medical Center and the Department of Health confirmed a recent case here on Oahu.
The patient is being treated at Queens Medical Center. They tell me they're currently investigating potential sources of the disease.
I learned that the disease is caused by a bacteria called Legionella. Those infected have severe flu-like symptoms, muscle aches, fever, cough, or loss of appetite. But how do you get it? I spoke to Dr. James Ireland to find out. He tells me you can't get it from another person. It's transmitted through contaminated soil at digging sites, but most often through contaminated water sources.
Not water that you drink, but more water that you, it gets aerosolized and you inhale.
That means water mist out of shower heads, sink faucets, cooling towers, hot water tanks, heaters, and hot tubs. Any water reservoir contaminated with the Legionella bacteria. The good news is,
once someone is who has the infection is in a hospital or some other environment, it would be, unusual for them to be able to transmit the disease.
The bad news is Ireland tells me the disease is often seen in clusters. That's why finding the source is very important, especially since it can be fatal. The number of cases diagnosed in Hawaii has increased the last 2 years. I wanted to know who is most at risk.
People who use tobacco, smoke cigarettes, have lung disease such as COPD or emphysema, or people who have a lowered immune system.
Legionnaire's can be treated with antibiotics, but it's difficult to prevent.
There's no vaccine, and it is very rare, so usually prevention is not something that we talk about or think about.
It typically takes 5 to 6 days for a person exposed to the Legionella bacteria to show any symptoms. We'll follow up and let you know the source of the infection once it's confirmed.